G'day everyone, welcome back to the channel. So in today's video we're going to talk about sacroiliac joint pain, but how the lower back can affect how that feels. And this video follows on from a previous video that we've done, and I'll link it up here, in regards to how stiff hips can really short circuit how the pelvic joints function. And the idea being that if your hips are stiff and they're the joints that are immediately below that SIJ, then a lot more force, a lot more movement, a lot more pressure goes through those joints and can set you up for some dysfunction. So if you've had some SIJ pain and you haven't had your hips checked out, give that video a watch just to give some context behind what we're going to go through today. Because this time we're going to focus on the things above that SIJ. And in a lot of cases that I see clinically, a lot of people come in with a diagnosis of sacroiliac joint pain. And obviously they get pain down the back of the base of the spine, across the hips. And it can be very specific, and you can have maybe the pelvis that's not aligned very well, maybe there's an upslip or there's rotations through the ilium or something like that that's jamming up that joint, creating some pain. But in a percentage of people, and a lot more people than I think we realize in the industry, a lot of people have sacroiliac joint pain that isn't sacroiliac joint based at all. It's actually a referred pain from the lower back. And I've done a previous video again on how there's a band of back pain that you can have that goes across the lower back, really across where those pelvic joints are, that can come from a spot that's higher than you realize. And that spot's at the base of your thoracic spine. So what I want to go through today is, if you have sacroiliac joint pain, I want to show you a very quick assessment / very effective exercise to figure out what role, if any, your back is playing in your SI joint pain. So what we want to basically do is, if you can grab a lacrosse ball, grab a tennis ball, grab a ball that you feel very comfortable lying on top of. And what we're going to do is we're going to start up very high. So obviously most SI pain is down low. It's at the base, around that tailbone, either side of that tailbone, a little bit higher in between your back and your hips. We're actually going to start right at the base of your rib cage. So I'm going to get you to place the ball right on the spine in the middle, and then gently let that ball roll off to one side. So I'm not going all the way across. I'm going to let it press into a part of your back, and then we're going to get you to lie down on that ball. So essentially what you want to do here is you want to move the ball around, go looking right next to that spine for joints that feel stiff and tight, and we want to let the ball press in. So we're not rolling around on top of the ball. We're going to find a spot that feels a little bit stiff and tight. We're going to let the ball press in for a few seconds. We're going to take a couple of deep breaths to allow that ball to free up some of that tissue. If it feels tender, that's important obviously, but then we want to get you to compare it to the same spot on the other side. So if you let the ball roll across to the other side of your spine, take note of how well that ball sinks in. So for a lot of people, the pain, the tenderness, and the tightness are all going to be on the same side. But for about sort of 40 to 50% of people, the pain is on the opposite side to where the restriction is. And for the purposes of this video and the purposes of this exercise, we actually care more about the restriction, because that could be causing your pain, and it could also be causing some referred pain down to that SI joint. So again, once you've found a spot that feels a bit stiff and tight, stay there for a little bit, let the ball press in, let it free up, then just move the ball down one segment, go looking for the next spot. So ultimately we're looking for things that feel important to you. We're spending enough time on the ball for that to free up, and then we're moving on to the next spot. And what I want you to pay close attention to is take note of how your pelvic symptoms feel. So if you feel like you're getting some general aches and pains down there while you're pressing on your back, and then when you move on to another spot, those aches and pains aren't there anymore, then the spot that you are on is potentially the spot that's referring pain to that SI joint. So I can't stress this enough. It's really important to make sure that when you're trying to solve sacroiliac joint pain, it's actually more than just a sacroiliac joint problem in a lot of cases. So again, in the previous video, we spoke about how stiff hips can cause extra pressure going through those pelvic joints. In this one, I really want to highlight that your lumbar spine and the base of your thoracic spine can be referring pain to that SI joint. Further to that, even if those spots aren't directly referring pain to your pelvis, stiffness and restriction in those areas can do the same thing as stiffness and tightness of your hips, where it can force the next most mobile structures to become overloaded and dysfunctional. So if the base of your spine is stiff, if the base of your thoracic spine is stiff, it can just mean that you're moving through your pelvic joint more than you probably should, which again could be correlating to why you have pain. So beyond just reaching for a sacroiliac joint belt, beyond getting your pelvis manipulated and reset and realigned consistently, make sure that you're looking below and above those areas. And in the case of this, if you can grab a lacrosse ball or a tennis ball, go hunting through the base of your rib cage and just below that, you might find that your sacroiliac joint pain isn't sacroiliac joint pain at all. It could just be referred pain from your back. So as always, if we're finding that there's some stiffness, if you do find that there's a part of your back that you press the ball into and it reproduces all of your pelvic pain, clearly that's really powerful. But the next conversation that we need to have is to focus on why this section has become a problem. And for most people that I see clinically, the answer is really simple. It's often that section is stiff because that's the section that you're hinging through without realizing it day to day. And that can be, excuse me, sitting at a computer, that can be a number of different things. But ultimately, if there's a section of your back that's correlating to your pelvic pain, if it's there, it has to be there for a reason. And traditionally it's there because we're hinging through that area and staying there for a lot longer than we should. So if you're working hard to free up your hips, if you're working hard to free up your lumbar spine and your thoracic spine, we then need to make sure that you're putting them in a better position. So please keep that in mind. Let me know in the comments below if that's resonated with you. If that's hit a piece of the puzzle that you didn't realize you were missing, let me know. Please leave a like on the video and obviously subscribe to the channel if you're new. I want these videos to reach as many people as possible, and I can only do that with your help. So with that being said, I hope that was helpful. Thanks for watching, and I'll see you next time. Bye.